Remember that land marking shows you where it comes out, roughly. It's not the direction of the piriformis, it's just enabling you to start to treat it. The direction of the piriformis is almost transverse across, a little bit of a diagonal. And so I tend to hold the hips, find that piriformis, get in, and work across it like that. So you could say that that is part one of your trigger pointing. Deep, slow effleurage working along the grain of the muscle. And it's intense, and it's a nice way to start, because you wouldn't want to go in on full stretch and then jam your elbow into it. It'll hurt, and then they will tense up under that pain. So you really want to make sure that everything you do, you layer up your work. Do a little bit of work across it, and once we've done a little bit of work into it, it's then a case of taking the leg, and now we can do a couple of different things. It depends on your client and what techniques you want to use. All of them are effective, but they're not effective if your client doesn't buy into them. So it's all about the way you sell the work that you're going to do. So we could go on full stretch, find that painful piriformis, so about there, and directly on it. Good. And we could go into a functional technique, the positional release. So that's piriformis, I can feel it soften underneath my elbow. And that's probably going to be like next to no pain in that point. Hold it for 2 minutes under that light palpation, and then when I come back, the pain will have gone. Yeah? It should feel a bit easier.
It's painful there.
It's painful there. We won't hold it for 2 minutes. So you need 2 minutes. It needs to be purely passive, and then I put it away. Or we go the other way. So we take the piriformis, we kind of keep him in a softened position, bring the elbow in, and I am moving along the piriformis and moving the leg out to create a stretch, and that increases the intensity. The amount of intensity you want to give depends on whether your client is able to stay relaxed under that soft tissue release. So the leg is in a neutral position or slightly internally rotated. Apply my block, and then the muscle is moving along my elbow longitudinally, and it's causing nice breakdown and the strip down of all those fibers. So soft tissue release works really well. You could go in and transverse friction it, so we go nice and deep, and then just work across it like that, and that's quite painful. It can be quite sore, but they will all be doing a job. So transverse friction, soft tissue release, adhesions. My favorite thing really when I'm treating it is to go in with those soft tissue release, to go in with those transverse frictions or simple kneading frictions. Both of them do a really good job on the piriformis. And then when I've finished breaking down any adhesions that are within the piriformis, I will just simply apply a little bit of pressure to the outside of the glutes, just to stabilize him, because I don't want him following me as we put him on stretch. I mean, the improvement is really quick, because we're moving down quite a lot in a short space of time. But just stabilize the hips, add a little bit of stretch to the piriformis. Does it feel like a stretch?
Oh, yeah.
It probably doesn't feel like very much, but you can see that it's bouncing, and that's point of bind. So your METs aren't all about creating a really intense stretch. That's PNF stuff. This is about finding that bind. And you can see it's on bind because it bounces back. Bind is like where the muscle is pretty much at its end range. And then pushing your ankle into my hand. Perfect. So I've given a really simple cue of putting my hand on his medial malleolus. He is able to then push back against my hand, which is innervating the piriformis, because it externally rotates when the knee is internally rotated. Hold for 10 seconds and release, let it go, and then gradually just tease the leg into further internal rotation. Some of the techniques are based on how we utilize the muscles. I wouldn't be asking for a reciprocal inhibition to further internally rotate actively, because that's like a really hard thing to instruct someone to do. Can you actively internally rotate for me? It's a tough one to actually kind of figure out what they need to do. So sometimes the post-isometric is just a really simple one, because I have a cue. It's a movement that they are able to initiate. If I put my hand here and ask for more internal rotation, it might happen, but it doesn't, to me, work as well as the post-isometric relaxation. But you can try both of those. And then just move it 3 times. On the last one, hold for 30 seconds and then allow them to relax. And that's a really nice treatment of the piriformis. And we can leave it there in terms of demonstration. But there is then another muscle just down here, which is quite flicky on you, and it's your obturator internus and externus. And you've got a flicky one of those. And that is another area that the sciatic nerve can come through. If you remember the piriformis, you'll be getting like 98% of the cases that come through. But there's a little glute max trigger point in there, and I just move across the obturators, internus and externus, and just see if those are sore. It's just to the outside of the ischium, just in this spot here. Have a little feel, there's a little bit of a flickiness there. So I might treat that one as well. So I can show you how to treat those ones. So once you've done piriformis, I can show you then obturator internus and externus as well, to treat down through there. The sciatic nerve is getting compressed here because it's overactive. It will also get compressed in and around the lumbar spine because that will be overactive. And whenever glute max is underactive, the hamstrings will be getting compressed as well.